Hi, good afternoon, everybody. I'd like to welcome you to today's monthly November meeting of the San Francisco Tech Council. My name is Andrew Broderick, and together with my colleague Carla Sumala, we are project co-directors for the San Francisco Tech Council. And that means we are the primary contacts for anything related to the daily activities of the Tech Council. And so please do feel free to reach out to us directly if you have questions or want additional information. I will put our contact information in the chat box. And just a quick introduction for those of you who are new to the Tech Council. We are a multi-sector initiative by bringing government, business, nonprofit, and consumer collaboration to advance digital inclusion here in San Francisco for seniors and adults with disabilities. And we were launched in 2015, and our mission is driven by this core belief that the most effective way to address all the complexities of connecting San Franciscans requires sectors working together and in partnership to do that. And so the Tech Council does serve as that community table around which all the different sectoral partners sit and discuss and explore opportunities for partnership. And that brings us to today's agenda, where I'm going to hand over to Anne Hinton, who serves on our steering committee and has been a long-time member since the early days of the Tech Council, and she will facilitate today's session. So Anne, over to you.
Thanks, Andrew. So as you can see from the agenda's title, Advancing Health Equity Through Digital Inclusion, the council itself has been very focused for the last, well, since actually I think since COVID, but before that as well, on how to pull together these different arenas, right? Technology, health, and how to make things like health, although we have interests in other areas as well, but certainly how do you make healthcare accessible to people who are now in the situation with COVID. And we're going to move on to Aurora, who is with the Mission Neighborhood Center and is responsible for the Healthy Aging and Disability program there. And I just want to say that unlike, there are a lot of commonalities between the Bayview organization and the Mission Neighborhood, but one of the things that is distinctly different and I think really interesting, and it's also another place you should go visit when COVID's over, is it is a Mission Neighborhood Center. So unlike many of the centers that we have visited as a Tech Council, where the focus is on older adults and younger adults with disabilities, Mission Neighborhood Center really focuses on the neighborhood. So it is really open to everyone.
And as you say, my name is Aurora Alvorado, and I'm the Healthy Aging and Disability Program Manager for this program. So our center is located in the Mission District. One of the centers that has been, one of the districts has been impacted and affected by the COVID-19. We used to be that kind of centers that, they enjoy, the seniors enjoy to come to the center, have field trips, have birthday celebrations, cultural celebrations, dance, exercises, and all that kind of activities that help them to engage, socialize with other people at the same age. We provide services to the Latin community, but also to the Asian community primarily, here in the district and all over the city. We have seniors that come from Embarcadero, or others from Chinatown, others from Excelsior. So we receive people from all over the city. So as I say, our center came from this part to this part where, when the pandemic started, so we have to stop to that the seniors come to the center, and we start delivering the services over there. So through over to their door. So with the lockdown and with the start of this pandemic, we have seen a lot of problems, healthy problems, and also behaviors that many of the seniors used to have, but that now are worse. And we have seen other seniors that never had present all these kind of issues, but now they are facing this situation. And I'm talking about social isolation, loneliness feelings, social disconnectedness, depression, anxiety, irritation, excessive worry about the current situation. We have a couple of seniors that they were calling us different hours a day just to know what they can do. They also, many of they lose sense of time. We have seniors that we are serving meals from Monday to Saturday, and sometimes in Sunday they call us to see where is my food, and we have to explain it. Today is Sunday, so they are losing the sense of time, and it's very sad. Also, we have seniors that they lack of access to healthcare. So because many of them they just this one was the center to come and just to have uh, we call to the doctors and make the appointments. Now that they couldn't come, they're afraid to go to the doctor. So it was pretty sad, the situation. So we have to come and start being creative with the activities, and we make a plan immediately, and we start doing our services become deliverables. Our concrete meals becomes delivery meals Monday through Saturday. Our food bank distribution, they used to come over here and pick up their vegetables and groceries. Now we have to pack all these bags and deliver to them at their door. Also, every month they receive emergency essential items like toiletries, paper towels, toilet paper, and many things. So the seniors don't feel the necessity to go out and buy this kind of items. Also, WellCause has been a great access to the and a great access and a great point of contact between our staff and the seniors. So we know with the wellness calls, we just know about how they feel, how they are doing, what they need. So that's why we know about all the issues that they are facing. We also have to start giving social services by phone. Now we are giving it in the office, but it's just one for appointment only, and they need to call first. But also we came with the idea to start giving virtual activities by Zoom, and start doing with this, we start doing individual support training. As you can see, these are some of the classes. This is the guitar class, and they really enjoy the seniors having the class. And also, this is an intergenerational activity. This was the music class. We used to have the intergenerational activities here at the center, but now when this start, then we start, okay, if we cannot do it with the children that they used to come to the center, then let's do it with their own grandchildren or friends or nephews or niece, just to enjoy the moment. So we also start delivering tablets. We partnership with CTN, and the 25 of our seniors were granted to receive a free tablet. And also we receive a funding from another organization, and we afford to buy another 40 tablets to start delivering to the seniors and start giving the support. So these are the pictures that I was telling you about how the seniors used to come to the center and have these activities, just making. Now these are the type or issues that we find in our seniors right now facing. um, our services, become deliverables. And also, as you can see, these are the pictures of the Zoom classes that we have right now. Sorry. Um, it has been amazing how the seniors adapted to this new modality. But I think in one point it was because before COVID-19, we used to have computer classes here at the center, and many of our seniors participated in these classes. So they were be able to just need to be trained on how to use the Zoom because it was new for them. They know how to turn on and turn off the computer and how to move everything. So it was a little bit of challenge just to give the technical support. But so far, right now, the group that they are receiving the tablets, they are doing great with all the activities. So the technology has helped us a lot. We have been relying in this in the technology devices and also in the internet services to provide virtual activities. We have activities from Monday through Saturday, and all of the activities has been well attended. Also, we can also connect clients to socialize with other friends. So they used to have one happy hour during the week, just to know, just to ask how they are doing. And also, it's amazing to see them when we connect the class. We always start the class like 10 minutes before, and they are ready just to be there and talk a little bit with their friends. So it has been amazing. Also, another thing that the technology has helped is to have the virtual doctor's appointment. Here is one of the seniors that needs the tablets just to have the medical appointment or the medical training that they give in. We also have been able to help the seniors to order food or also medicine online because you're gonna ask why food? Because we're delivering meals, but it's only the lunch, not the dinner or the breakfast. So many of our seniors are not being able to cook in their homes. So this has been a great opportunity for them. But I mean, we right now are helping like around 55 or 60 group of 60 seniors to have the tablets and to participate to the activities, to the virtual activities, and to some of them to have the virtual appointments over the tablets. But we'll still have a large group that they're missing, and they are asking the opportunity to have a tablet. So right now the barriers are like they don't have access to technology devices, and I mean free technology devices, because we work with very low income families, and very low income seniors. So they don't have the possibility to get a new tablet. Also, the lack of internet services. It's amazing how our seniors are living in a small room or maybe sharing a room where the landlord cannot give permission to install the cable or install the internet. Also, we find some of our seniors that when we offer the tablet and also the service like hotspot, they didn't want it. They denied because they say it's gonna be a extra cost in my monthly income, and my monthly income I'm so tight with my monthly income, and we really understand. So, but with this group, we are helping them just to, we are offering the free devices and also the internet services, and we are paying for that. But as I said before, still there is a large group that is still in need of the access to technology and to devices. We also find another problem that is the training support, and is this the bilingual technical support, because we find that many people just speak Spanish, and that's a problem because we couldn't find volunteers to help them. Oh, if we find a volunteer, it's there are a lot of seniors that needs this technical support. Also, we find out that one of the barriers for this tech is the lack of confidence in the participants' own ability to learn. And I'm talking about seniors that when we offer the tablets at the beginning, they were afraid. They say, no, I don't want it. And we were wondering why you don't want it? We are offering free, and we were offering the internet. And they say, no, I'm too old to understand. I'm too old to learn. And we have to work with them and just make them feel confident that they can learn, they can do it. So yeah, it's a little bit challenge, but it was nice. And some of the seniors that never in their lives come to the computer class, they right now using the Zoom classes and using the tablet to connect with their family too. One of the recommendations that Carla asked me to do, talk about the tech recommendation. It's we need that the internet is free, and at least for the low income seniors, because this is a necessity. It's not just like another thing. It's a necessity now in this time that we need to connect by this service. Also, we need more volunteers that are bilingual, and they can provide training support for our seniors. And also access to free devices. Because as I said in the beginning, we are helping a large group of seniors, but there is a lot of seniors that they still need the devices and the service. And that's it. Thank you.
Thank you, Aurora. That was a really interesting presentation. I liked your comment about people don't have the confidence, right? And also we know, right, if people are told enough times that if you're older, you can't learn anything new, it does become its own reality, which of course is part of what's happened here, because we all know older adults are quite capable of learning other things. I had just one follow-up, and then we'll move forward. But the question I had is, do you have any idea if the majority or of your folks that you're seeing have family support?
Yes, some of them, they have family support, and it was easy to talk with them and also with the caregivers. Mm-hmm. So because they were the ones that connect the seniors, but also we have a large number that they are by themselves.
Yeah. Okay. All right.